presentation with the video. So just to ensure that there's no feedback, if you could please make sure that your microphone is muted. And good afternoon, and welcome to the 2024 budget hearings for Franklin County, Ohio. The next agency we will hear from is the Franklin County Department of Job and Family Services.
At Job and Family Services, we envision a Franklin County where all residents are stable and have pathways to opportunities and success. We see it as our mission to create those pathways by providing timely public assistance benefits and building community partnerships through inclusion, responsiveness, and innovation.
Helping meet core needs, things like food assistance through SNAP, Medicaid health coverage, publicly funded child care, or emergency housing assistance through our PRC program can have a transformative impact on the lives of the residents and families we serve.
Nearly 1 in 3 Franklin County residents engaged with JFS in 2023, nearly 1,000 people for every one of our employees. That's an enormous impact and monumental responsibility, but it's only part of what we do.
We also provided tens of millions in funding to support an entire continuum of supportive services offered by community partners across the entire county. That includes initiatives like Franklin County Rise, which offers childcare scholarships for working families and incentives for early learning providers.
They've been loving it. I've been doing incentives even for attendance. I've been giving them bonuses as I've been getting grant money, and they are absolutely, I've been letting them know it's as a result of Franklin County Rise program as well.
Summer employment and paid work experience opportunities for teens and young adults through our Ready to Earn program.
Honestly, they make sure that you know what you're doing. They make sure that you remember everything, and they honestly prepare you like a really good job. So I would just recommend this.
I would definitely recommend this program to anyone. You don't even have to be interested in the field. It gives you knowledge that you can learn and apply to anything.
And innovative workforce programs aimed at addressing historical disparities and shattering glass ceilings, like our Tech Women of Color initiative.
Our next graduate is Kawana Miller. Who says, I decided to join the Persola's Tech Women of Color program because I wanted more for myself. This program showed me my own strength and resilience. It wasn't easy, but nothing worth it ever is.
As we prepare for 2024, we are looking to employ more human-centric strategies to engage with the residents we serve and meet them where they are. We are also digging deeper into the data, looking for trends and identifying better ways to measure our impact.
We're pursuing new initiatives like our Men's Unit to support populations that have been overlooked or fall through the gaps of our health and human services system.
And we are committed to bringing that vision for Franklin County closer to a reality for every resident every day. Good afternoon, Commissioners and County Administration. My name is Michelle Lindeboom, Director of Social Services and Innovation for Franklin County Department of Job and Family Services. I am joined today by Vivian Turner, our Chief Administrator for Community Support Services and Partnerships, as well as Walter Dillard, Assistant Director and Chief Strategy Officer. We are here to request your continued support of our agency and the hundreds of dedicated public servants we have stationed across our 3 opportunity centers at more than a dozen hospitals and community organizations, and through our mobile unit in neighborhoods all across the county. This testimony will highlight some of the successes and challenges we have experienced over the course of 2023, and how we plan to apply data and lessons learned to continue to improve our operations and meet our commitment to the hundreds of thousands of residents who rely on us in 2024. I will begin with our largest program, Medicaid. This past year has been another unprecedented one for Medicaid, as federal waivers tied to the COVID-19 public health emergency came to an end. During that time, states were largely barred from disenrolling individuals from Medicaid, and we saw enrollment increase as a result, reaching a record high of over 458,000 this March. With the passage of the Consolidated Appropriations Act of 2023, the process of unwinding commenced, And in April, Ohio began conducting full eligibility redeterminations and terminating coverage for individuals who no longer meet the eligibility criteria. Leading up to that, we worked with community partners to make sure our residents weren't blindsided, because as many as a third of them had likely never undergone the redetermination process. The Ohio Department of Medicaid conditioned federal funding, which is made available to county JFS agencies to help offset the increased administrative burden from unwinding, on those agencies achieving a 90% processing rate for redeterminations due during a given month. About half of redeterminations due go through an automated renewal process, leaving our agency with an average of just over 9,000 redeterminations each month. We have achieved or surpassed 90% benchmark in all but the first month of unwinding, and the net result is Medicaid enrollment in Franklin County has fallen by more than 34,000 over that span. However, there are countless consequences of this undertaking. Foremost, thousands of residents losing healthcare coverage, but also an increase in appeals and hearings as a result of discontinuing coverage, as we had warned of last year, an increased administrative burden on an already strained workforce. Let's first look, though, at what we know about Franklin County residents with Medicaid. We know that it's a high priority zip codes in that inverted T with the highest number of Medicaid recipients. Nearly half of all Franklin County Medicaid recipients are children or seniors over the age of 65. And of the working aged adults receiving Medicaid, 37% are caregivers that are eligible through covered families and children. Nearly 19,000 fall in the age, blind, disabled category. They likely have been and will continue receiving Medicaid their entire lives. The largest portion of working aged adults, a little over 97,000, are covered through the expansion of Medicaid, made possible thanks to the Affordable Care Act. That's less than a quarter of the entire Medicaid population. We're going to use tools like Qualtrics to survey residents about their experience with Medicaid and identify ways to better connect them with resources and information about county workforce development programs like Building Futures or Tech Women of Color. We're also going to ask about utilization of their benefits, which falls under health goal number 10 of our Rise Together blueprint. Because how are we going to improve health outcomes if providers won't accept Medicaid? We're trying to learn more about the residents who have lost Medicaid as well. Is it because they have gotten a good paying job with employer-sponsored coverage? We do know that nearly 2/3 of residents who have had their coverage discontinued this year lost it because of failure to cooperate with the renewal process. It's people that don't submit their renewal application, completed or otherwise. And we know that nationwide, 1/3 of people discontinued from Medicaid end up back on the rolls after a period of uninsurance. That's an opportunity, although a daunting one, because that means with better technology and with better outreach and education, there's a chance we can cut into that churn. It's important because it can allow us to avoid unnecessary hearings. Residents maintain their appeal rights if determined ineligible for Medicaid, and we have experienced that predicted increase in hearings. As you know, we hit a backlog in hearing compliances earlier this fall. We took swift action, both with regard to business processes and personnel, to address it, and we're confident that changes we have put in place will prevent it from escalating to that level again. But we're still dealing with an unprecedented number of appeals and hearings due to unwinding. Reducing churn should curb that. I've spent a great deal of time talking about Medicaid, and we need to because it's the largest program we administer. There are enough Franklin County residents enrolled in Medicaid to fill the horseshoe 4 times, but it's just part of our story. A month before the beginning of Medicaid unwinding, our second largest program, SNAP, experienced a different kind of shock with the ending of emergency allotments. Implemented in March of 2020 as part of the Families First Coronavirus Response Act, SNAP emergency allotments ensured all households received the maximum allotment for their household size. The original legislation authorized states to issue emergency allotments throughout the duration of the federal public health emergency. But this year's federal appropriations bill ended that authority 3 months early. We learned in January that the final round of emergency allotments would be issued the following month. And that meant $12.5 million in SNAP benefits normally dispersed across 70,000 plus household each month would be coming out of the Franklin County economy. This was occurring in the midst of ongoing inflation, while food prices, things like eggs, were soaring. And we worked with the community partners and faith leaders to ensure residents were not blindsided and could mitigate the loss in benefits. There are also things we can and must do to improve efficiency in order to better meet our commitments to the residents we serve. Part of that is, again, looking deeper into the data and asking some of the same questions we are talking about churn in Medicaid, more specifically what our STAR team has coined procedural churn. These are cases where people were denied or discontinued for some reason other than meeting the eligibility criteria for SNAP. In the case of denials of new applications, we're overwhelmingly talking about missing interviews or failing to verify their income or employment. Missing interviews account for over half of all SNAP intakes denials this year, more than 23,000. Curbing that number and the duplicate applications that result from it is an equally daunting and necessary challenge for us to undertake. Staffing capacity is a large variable, and I'll touch on that shortly. But the other variables are technology and business processes. The state's county shared services phone system has its share of challenges. We are aware of the burden it imposes on residents who often wait on hold for hours and only to have their call dropped. Our staff, by and large, are not responsible for those dropped calls. It's the system. The county shared services business model is a one-size-all approach that doesn't fit large metropolitan counties. That's why we plan on making significant operational changes, including a return to caseloads in 2024. This is a more human-centric approach that allows for greater flexibility and accountability. However, it's still a math problem. We need enough people to pick up the phones to complete interviews. In 2024, we're going to be employing an array of different strategies aimed at retention just as much as recruitment. The new Employee Support Services program, which Assistant Director Dillard will outline later, is a big part of that. Retention is so crucial because it takes 10 weeks to train a caseworker, followed by another 13 weeks in a transition unit, and often more than 12 months to get them fully acclimated to the position. And even if we could immediately fill every vacancy as soon as someone left, we wouldn't even be treading water. We'd still be sinking. That is why we are requesting $54.3 million in personal services and fringe benefits to support our dedicated staff, as well as temporary staffing. We are also requesting $10.7 million for materials, supplies, services, and a capital building lease. I am now going to turn it over to Chief Administrator Vivian Turner, who oversees community support services and partnerships for the next portion of our testimony.
Thank you, Michelle, and good afternoon, commissioners and county administration. While enrollment in some of our core federal public assistance benefits is on the decline from pandemic highs, it appears to be driven by policy changes more so than the reduction in need. The steady increase over the last year in requests for emergency financial assistance, overwhelmingly housing assistance, available through our Prevention, Retention, and Contingency, or PRC program, and its offshoot programs, supports that theory. The standard PRC program uses temporary assistance for needy families, or TANF, to provide short-term, crisis-oriented benefits. To assist low-income families, and housing assistance is one of the most prevalent needs we're seeing. Combined, we issued over $16 million in emergency housing assistance to keep over 2,500 families in their home over federal fiscal year 2023. Standard PRC covered just a sliver of that compared to the more flexible federally funded PRC Plus and PRC emergency rental assistance programs. I'd like to talk a little bit more about those families we serve through our emergency housing assistance suite. An analysis by our STAR team of emergency housing assistance recipients from January of 2022 through September of this year found that 92% were women, 91% headed single-parent households, and 81% identified as Black or African American. Most of our approvals are families living in hotspots, with the most eviction filings in the county. Areas such as Whitehall and the Far East Side, Northland, Linden, the Hilltop, and the South Side. It's important not just to know who we're serving, but how well this intervention is working. The most encouraging finding from our analysis was that over 82% of families approved for emergency housing assistance in that span have not had a subsequent eviction filing. We believe that's strong proof of concept for this intervention, but we didn't stop here. We also looked into that segment that did see a subsequent eviction filing. On average, those filings came 6 to 8 months following approval, a sign that the intervention was still effective, a bit to a lesser degree. All of this analysis is important because eviction filings are on the rise. We've seen a 31% increase in eviction filings from pre-COVID numbers, and Franklin County is on track for a record high upwards of 24,000 filings this year. We know the trauma of eviction can have negative long-term impacts on the entire family and the entire communities. PRC is much needed, highly effective eviction prevention tool. However, we acknowledge that PRC Plus and PRC ERA are supported by limited time federal funds, such as ARPA and the U.S. Treasury Rental Assistance Funds, respectively. And when this funding is expended, the need is still going to be here. We approach the biennial process of updating our standard PRC plan with that in mind. Some of those changes included increasing the income eligibility threshold to 175% of the federal poverty level, increasing the benefit cap to $2,500 for emergency assistance and $1,000 for disaster assistance. For the first time, permitting non-custodial parents to qualify for PRC, and implementing a new 6-month pilot to provide presumptive eligibility for recipients of SNAP and OWF. We have designated $3.5 million in TANF funds to support our PRC program through federal fiscal year 2024, and will work closely with county administration, the Office of Management and Budget, and our network of housing assistance partners to ensure we can continue to support residents and families with housing insecurity. These are important considerations given that the TANF block grant has not risen since the federal legislation was originally passed nearly 30 years ago, and our annual allocation is all but flat from year to year. That funding mostly goes toward the innovative early childhood readiness, youth, family stability, and workforce development programming we're able to offer through our funded community partner agencies. That includes year-round programming for elementary and middle schoolers and their working parents and caregivers. We had over 1,400 children enrolled in our funded after-school programs for the 22-23 school year, and another 1,600 who attended our free all-day camps this past summer. It's programs like Ready to Earn, which provides teens and young adults with work experience, career exposure, and subsidized employment. We had over 900 young people enrolled in Ready to Earn programming this past summer. On top of earning a combined $1.7 million in wages and incentives, more than 370 also obtained industry-recognized credentials, including the young people you heard from in our video that were enrolled in state-tested nursing assistance training and automotive repair and technology programming offered through one of our partners, Lead the Way Academy. We celebrated 64 new graduates from Roads to Work, a partnership to prepare unemployed and underemployed residents for commercial trucking careers, where wages can start at over $50,000 annually. Meanwhile, another 171 residents graduated from our award-winning Building and Driving Futures program, with another 20 slated for graduation tomorrow. Thanks to your advocacy, this innovative pre-apprenticeship program was recognized by the White House, and with the support of Senator Sherrod Brown, we received an additional $686,000 in federal funding. We are grateful for your ongoing commitment of ARPA funds to support these innovative and life-changing cradle-to-career programming over this past year. These are historical investments that place equity at the center. That includes Franklin County RISE, which provides child care scholarships for working families, incentives for early learning programs, and support for early childhood educators. We're going to be taking lessons learned in year one, the successes and the challenges, and applying them as year two of this $23 million investment commences. We're looking to engage with additional partners to ensure we're better able to meet the broad needs of both our families and providers. The data we collect over this next year won't just go toward assessing the efficacy of this program. It will also help inform our comprehensive early childhood and birth to 8 strategies for the entire county. Because we know that ARPA dollars are limited, and we know that early learning investments are some of the savviest uses of public dollars, with returns as high as 9-to-1. We have also continued to use ARPA dollars to support the innovative Tech Women of Color program, which focuses on historical disparities around race and gender in one of the most in-demand and best-paying career fields, information and technology. It supports the Rise Together Blueprint, which calls for increased investments in career training for credentials that meet the local employer demand, employers like Intel. Although we've had 82 graduates through the first year plus of Tech Women of Color, with another 41 women currently enrolled, about half of the graduates have already been placed in employment or apprenticeships, earning an average hourly wage of $20. We have even been able to use Tech Women of Color as a pipeline to address our own staffing needs, and graduates have played a critical role in analyzing much of the data that has informed this testimony. We hope to have your support to continue to invest in innovative programming to empower residents and families throughout our community, which is why we are requesting $71 million for social service contracts and programs in 2024. I'm now turning it over to Assistant Director and Chief Strategy Officer Walter Dillard to discuss our strategic initiatives and our community outreach efforts.
Thank you, Chief, and good afternoon, Commissioners and County Administration. So we have spoken at length about public assistance benefits and supportive services our agency provides. We've spoken about ways we are looking to use data to help better meet our residents' needs and connect them with additional resources to get them what they actually need and not just what they came into our agency for. This is that sort of holistic, human-centric approach that is at the very heart of our One Door initiative. And while that's a massive undertaking in this kind of multi-year initiative, we're starting to see proof of that very concept already through the work of our collective impact model in the Family Stabilization Unit, or FSU. FSU uses Bridge Scores, which is a measure of self-sufficiency and economic mobility, which takes the different pillars of the social determinants of health into account. Things like family stability, housing security, finances, education, and employment. The scale goes up to 100, and the lower someone pings across any of those pillars, the lower their Bridge Score. Conversely, the higher their score, the higher their degree of self-sufficiency. So every young person, every family FSU comes into contact with, they have their own story and face their own unique challenges, but the data we capture helps paint a larger picture of our community. The greatest need we see for our families, for instance, is housing, with nearly $267,000 allocated in 2023. However, we also connect families with core needs like food and health coverage, as well as resources like mentoring, financial education, or career training. It's all through this intensive holistic approach that we're able to achieve the transformational change we strive for with all the residents that our agency serves. And we see that reflected in part through an increase in the actual bridge scores. As a matter of fact, individuals that have completed the program on average saw a 96% increase in their bridge scores over their time in FSU, from a baseline of 28 to an average of 55 upon exiting. Current participants have seen a 33% since enrolling. But what does this look like in practice, right? It looks like Savelle Beacon, a 34-year-old single mother of 4 children, ranging from 8 to 15 years old. She first got involved with FSU through her son, but when she sat down for assessment last year, we started learning more about her actual personal education and career goals. And that actually began with her finishing high school, as she had been forced to drop out real early. So Savelle Specialist was able to enroll her in high school 22 plus program at the Academy for Urban Scholars, where she was exposed to an array of career options. In August, she began a dual STNA phlebotomy program, and since then, she's been working towards a high school diploma and certifications at the same time, all while receiving individualized career coaching. How is that possible for a single mom? Well, that's because FSU isn't just supporting her, they're supporting the entire household. That includes providing bus passes, academic support, mentoring for the children, and much more to assist while Savelle is in class and not earning an income. Savelle and her family aren't just an example of how the FSU model is successful, but in fact, why it is successful. This intensive, individualized, and ongoing case management approach allows us to collect data and engage with families enrolled at a level that we frankly aren't able to do with most of the residents that interact with our agency. FSU has 16 staffers supporting the 180 families, some of them quite large, enrolled in the actual program. In contrast, we have 1 Ohio Benefits case manager for every 1,000 residents that receive some form of JFS-administered core public assistance benefit. This collective impact model is doing so much more to inform our approach as an agency and as a health and human services collective. That includes making a greater effort to meet people in the community through our mobile unit, which has attended over 60 events and connected more than 700 households with services this year. But it is also shining a light on cracks in our system and, unfortunately, the people that fall through them. One population that is historically overlooked is men, including single men who are non-custodial parents. These men, especially Black men, are the demographic that face some of the greatest disparities all across the social determinants of health. They're overrepresented when it comes to housing insecurity, negative health outcomes, chronic conditions, education, employment levels, and of course, injustice involvement and mass incarceration. And in many cases, this prevents them from being involved parents that leads to negative life outcomes for children as well. Yet, many of the policies, especially for federal programs administered by the funds and allocated to JFS, exclude that group. That's why we are standing up our new Men's Empowerment Network, which will be applying that same intensive, individualized, and ongoing case management model that is the trademark of FSU to serve men that our system would otherwise ignore. The collective impact model is also helping inform our approach to employee retention across the county. Our budget request includes funding to continue our employee support services program. This pilot under strategic initiatives is designed to support county employees and provide additional access to community resources. Employee Support Services, or ESS, had its soft launch in July this year, and it mirrors the FSU model to meet the unique needs of each employee. Our ESS unit will consist of 3 specialists to evaluate the needs of county employees seeking assistance and create a framework for intended outcomes and metrics, a key one being employee retention. This approach emphasizes the importance of ensuring that all county employees have access to the services and support that they require, not just to survive, but to thrive, whether that be at home or in the workplace. And now I'd like to turn it back to our director, Michelle Lindenboom.
Thank you, Walter. All that we've talked about in this testimony, the programs and data, the models and the people, is informed by our one-door integrated health and human services approach. Our collaboration with our sister HHS agencies, Office on Aging, Child Support Enforcement, and Justice Policy and Programs, is improving, and it's making a difference for our residents. That collaboration was on display at the beginning of the year when we partnered with the City of Columbus and numerous other community partners to support and rehouse the residents and families displaced from the Latitude 525 apartments following last winter storms. It's on display as we speak as our HHS collective works with many of the same partners to support and rehouse the hundreds of migrant families at Colonial Village. It's just another way our footprint at Job and Family Services stretches across the entire county, with over 423,000 residents on Medicaid, nearly 162,000 residents on SNAP, and 8,000 plus receiving Ohio Works First cash assistance. More than 25,000 children in publicly funded childcare, and an additional 600 who will receive scholarships through Franklin County RISE over the next year. The more than 900 young people who received paid summer jobs through Ready to Earn. The 300 plus kids in our free after-school programs and summer camps. And over 170 building and driving future graduates, and over 80 graduates for our Tech Women of Color program. We know we can and must do more because that's what our community needs. But we are proud of what we have been able to accomplish and the lives Job and Family Services has been able to transform in 2023. We will be happy to answer any questions you may have. Thank you.
Do we have any questions from commissioners on the line? I have a few questions. I would like to direct my first question towards Mr. Dillard. I would like to know, how is strategic initiatives planning to be woven into the One Door? All of the things that you've outlined, how will that be woven into the One Door, which would have all of the traditional partners, traditional health and human services agencies, but I see strategic initiatives as a hybrid of all of the agencies in certain respects?
Correct. Good question, County Administrator. So the first thing, strategic initiatives, it started with the basic training that we got. And the basic training was more than just the cross training that we got from aging, child support, JPP, and Job and Family Services. We also received training in what they call economic mobility pathways, which emphasizes mobility mentoring, motivational interviewing, which helps bring out a lot of the residents, especially in that lens of ambiguity that they have. And so that's a piece of the work that we're going to be putting in the One Door. Also in the One Door, people are going to be cross-trained across the different agencies and knowing what resources are available to our residents. And then the units under strategic initiatives, whether that is the men's unit, people from the men's unit working at the actual brick and mortar of One Door, mobile unit, and then housing unit as we build into that, that will also be a part of the One Door.
Thank you. How is the housing piece going to fit and be enhanced? Last year we introduced the housing unit. Now over the course of this year, we've had discussions around more formal approach to housing and emergency shelter, and how we do that in a way that is aligned and not duplicative of the Community Shelter Board.
So I'll kick that. You want to start, Walter, or do you?
You go first, Chief, and then I'll jump in.
So, County Administrator, first of all, we are in the middle of launching an initiative with our partners at Franklin County Public Health to support our temporary housing needs for our residents, specifically a lot of the residents that we've seen through FSU, as well as our PRC program. We're hoping to have that project or that pilot kicked off here in January of 2024. And we're hoping that they're able to partner with the Lodging Association, where we're able to support as many families as in need of temporary housing. support and also rehousing. We'll be working with them to hire additional community health workers in order to work with those families to quickly get them rehoused, along with working with their FSU counselors. Walter?
Yeah, and then I'll finish that off. And Administrator, as you know, the housing initiative, this is direct correlation from Goal 5 and Goal 7 of the Poverty Blueprint Plan. One of the things that we've already done was increase the financial assistance that we're going to use in regards to JFS, PRC, which Chief Turner talked about, but also the supportive services that we're going to have within the housing unit. And so the next steps is we're talking with Teresa and Public Health now, and as well as the Lodging Association to figure out hotels in those 4 quadrants of where residents are needing housing. Trying to eliminate transportation barriers, putting them on bus lines and things of that nature. So starting in January, we'll make sure we keep you guys abreast as to where we're at with that.
You know, as you know, Mr. Dillard, FSU was initially a pilot, and it's maturing where we no longer refer to it as a pilot in any way. How can we take lessons from FSU and apply them to the implementation of the Men's Empowerment Network to get that off the ground and moving in a more expedited fashion, because we've learned from the FSU experience?
Absolutely. Good question. So I was told by Deputy County Administrator, let's stop using FSU. And she's absolutely right, because we need to start focusing our terms more towards collective impact model, right? How do we break silo systems to not just deliver or render one service at a time, but look at this person or this resident in totality and figure out what are all of the barriers they have and who are all of the people that need to come to the table to assist in removing these barriers. And so when you talk about transferring that same model over to men, I don't think men need to be labeled as criminals before they get wraparound services. I don't think men need to be labeled as bad fathers before they get wraparound services. How do we do this? How do we implement this collective impact model? And right now they're utilizing child support to funnel their men by, because we're trying to make sure as we're adding on, we're going to have more referral sources. But I think that's exactly how you take what we're doing here at FSU and transfer that over to how we work with our men.
It's not a redundant program and purpose. I'm referring to what operational lessons can we learn as we operationalize the Family Stabilization Unit that we could carry to the Men's Empowerment.
Oh, gotcha. Well,
not the same public policy remedies, but operationally, how can that be done? And that sort of leads to my last question here as well for Director Lindenblum, is how, from an operations standpoint as well, we've been able to use what we know so far about the one-door model, along with the HHS companion agencies, to assist with the barriers and the service delivery issues around SNAP and Medicaid that are grand challenges for us.
Right. So what we've learned is pretty much all roads lead to JFS. So within the HHS One Door, we're kind of the hub, Job and Family Services, because the majority of the residents are on SNAP and Medicaid. So we've, learned to put some business processes in place to, as residents are coming in, filling out applications, they can get all their needs met. So they don't have to come in and fill multiple applications, because if they qualify for one of this, SNAP and Medicaid, our biggest programs, they probably have someone in the justice system, child support order, and someone with Office on Aging needs. So, yeah.
If I could, Director, ask a question on behalf of Commissioner Crawley.
Oh, go ahead.
Commissioner Crawley is traveling right now, but she is on listening. And so the first question she has is, what about master leases with landlords?
That is something that we have not explored, but it is something certainly we can explore as we continue to pursue our agreement with Franklin County Public Health and rehousing of our residents.
Okay, and her second question is, what are we doing to make wages more competitive to fill the vacancies for case managers understanding the job market and competition?
So I'm gonna jump in just really quick. Thank you, JFS leadership, for your extensive, presentation. So, Commissioner, what I've done is started looking at what are the competitive wages across the country to, counties that are comparable to ours, because, you know, many times what we're finding, just like in the childcare industry, people are leaving the childcare industry of, you know, where we need their hands to hold babies and teach children to go pick and pack because you can get paid more. When we look at the wages, particularly in the space of case management, there's few counties where I think their starting wages are like 22, and they had to increase $22 per hour. I believe Franklin County starting wages for case managers are what, $19 an hour, you guys?
21.31.
Okay, so it's like 21, 23. So I'm just kind of looking at those and seeing, you know, where we can be a little bit more competitive so that we can submit that information to the county administrator, in addition to looking at some of our other benefits that we provide to our case managers. But to all of our employee staff, but I believe our county administrator is looking at that, and I know there's going to be a study done here soon.
Joy, mute herself while she was talking.
I was done, sir. You have a question?
Oh. Okay. So I have a question, or not, I have a question, but, so as I'm sitting here listening to your presentation, and I'm listening to the questions that are asked by Administrator Wilson and then followed up by Commissioner Crowley, you know, I'm thinking, you know, listening to, you know, the conversation about Latitude 525 and Colonial Village, and I'm thinking about, you know, here we were almost a year ago, Christmas Day last year, and Latitude 525 happens, and the last, you know, month or so we've been dealing with, well, it's been more than a month, but in reality, the last month or so we've been dealing with Colonial Village. And I'm thinking about all the work that's been going on over the last, I don't know, many months with the one door work that we've been doing, and you know, the trips we've taken to, you know, New York to look at, you know, all the, you know, and the conversations that we've had, and I guess what I'm wondering is, have you guys, in all the work that you've been doing and all the conversations that you've had and the experience that we've dealt with in dealing with Latitude 525 last year and now dealing with Colonial Village, you know, I would assume, and I think I'm seeing it in your development. I'm seeing it in the work that you're doing, but I'm assuming that you guys are, you know, you've learned a lot through 525, Latitude 525 last year. Now you're learning it again with Colonial Village this year, and in development of the one door policy and all the one door work that's been going on, so that, you know, inevitably this is going to happen again. I have a feeling that, you know, we see these developments throughout the city, throughout Franklin County. We can almost see where it's going to happen and with which neighborhood or which development it's going to happen in. And we know these things are coming. We know, even if we don't know where it's going to happen, we just kind of have a sense that it's going to happen again. Are we ready? Or if we're not ready, have we developed a, you know, almost like a checklist, or have we developed a game plan because of our experience with where we were 11, 12 months ago, where we are now? Do we feel as a group, do we feel as though our experiences have made us better in this environment, in this situation, so that, you know, we handled Colonial Village? And I think I know the answer to the question, but I guess what this is to all of you guys to be able to, you know, to answer. But, you know, are we better today, and are we more prepared tomorrow for having been through what we've been through, and have we planned more or better for tomorrow because of what we've been through?
Commissioner O'Grady, tomorrow I will be attending a meeting with several large stakeholders to discuss just that. And to answer your question, you know, and I think the people boots on the ground can respond in a different way, but I'm going to say, as the person who oversees the HHS agencies, I'm going to say no. And the reason why I'm going to say no is because there needs to be an assessment of where all these developments are across the county, particularly they're more saturated in Columbus. And then we need to look at, on the scale of 1 to 10 or whatever, red light, green light, blue light, you know, where they are in to be more prone to those things happening like they did in Latitude or Colonial. Right now, we're hearing, you know, places like it could happen on the west side or it could happen on this side, but we don't know what that means. Does that mean the roof is going to cave in, or does that mean that the electricity is going to go out? We really don't know. And until we have that assessment, I don't think we can be proactive in trying to put together a strategic plan on what dispatching resources can do. Now, I will tell you, this team is phenomenal about dropping, regrouping, realigning, and dispatching out to go out to provide services.
Well, Joy, I'm not asking, is Jeff Young on the call? And are we ready from a EMA standpoint? I'm asking, are we ready from a human services standpoint? Are our agencies ready? You know, is JFS ready? Is aging ready? Is you know, are the people on this, you know, in Franklin County government, are we ready?
Mhm.
You know, and are we better prepared today to handle it tomorrow based on what we know from our experiences over the last 11 or 12 months?
I think we can respond.
Because we can, that's what I want to know.
Yeah, we can respond, but you know, just like all the other agencies, Commissioner, not just JFS, everyone's dealing with a capacity issue as it relates to employees. And you know, when these things happen, we pick up staff and we move them out, which could weaken the inner operations. So yeah, we're ready, we can do it, but it's still going to weaken the brick and mortar side of it. In addition to, technology would be a great resource for all of these teams. So they're not doing things always so manually, but having the ability to do more things automate from an automated side.
Yeah, and if I can jump in really quick, to piggyback off of DCA's remarks, Commissioner, I think last year during Christmas, that wasn't even building the plane as we flew it. We were just skydiving at that point. But I think JFS did a good job with coming back and readjusting a lot of policies that we have. One of them being the disaster PRC policy. We added to that because what we saw last year was that money that we had just simply was not enough to help relocate and rehouse people that went through that disaster at Sawyer Tower, as well as the allotment of PRC. Another thing that we're doing really well this year versus last year is our actual communication between the county and the city. The city has been doing really good with trying to find places for these 800 plus residents to go, but the county is making sure before they leave, they receive all of the resources that they possibly can before they're dispersed within however many quarter miles are in Franklin County. So is there a lot more work to be done? Absolutely. But do we have great service rendering when we're on site present? Absolutely. A lot better than what we were last year. And whatever comes up next year, I'm sure we'll be a lot more prepared for that as well.
And Commissioner, we could really use your support in regards to working with the city on putting together, and not just from a Jeff Young perspective, but I think the city has more of a better handle on when this, and that's the thing I really want to focus on. We can get them rehoused, we can provide the services, the money was great, we can do all those things. But if we can work with getting a plan of where are these vulnerable developments so that we can work with the residents now before the lights go out. That's, to me, that's being more proactive.
Gotcha. Well, the city should have a better handle on that with code enforcement and knowing and understanding where they have problems.
Absolutely, because what happens, similar to what happened, I think, during the pandemic, it exposes the most vulnerable and it exposes where residents are living that are really at that you know, desperate category. But again, I'm going to reinforce, if we know where they are now, we can be proactive aligning all of our dollars, not just job and family services, using targeted universalistic approaches and getting into those developments now so that either it moves people up the economic mobility ladder, they can move, or we can put them in a better position before an ice storm hits.
Gotcha.
Can I ask a question to follow up on Commissioner O'Grady's question?
Yes, ma'am.
Okay, sorry, I missed part of your answer because my internet cut out. I'm in the airport, so I apologize. And I will ask Jeff Young, Director Young, next week when we have our 911 planning meeting. I heard you, DCA Bivens, talk about an assessment that the agencies aren't ready. And to Commissioner O'Grady's point, we are like a year out from what happened to Sawyer Towers. And so we are not prepared, or our agencies aren't prepared because one, an assessment hasn't been done. But as soon as that happened last year, we asked specifically for there to be some kind of debriefing to say what didn't work, what did work, and how do we address these issues going forward. Has that been done? And if not, do you have an idea of why that hasn't been done?
I believe
so our agencies could be more prepared.
Yeah, I think they're working on it now. Commissioner, I think Jeff Young has been pulling folks together, and I think he's been very intentional about trying to figure out what are the parts that play into that on various levels. I have not seen the plan yet, but I know he is working on that. And respectfully, I do not know when that plan will be done.
I mean, I will, again, we have a meeting next week for 911 planning, which is different from this, but I think even what we see going on with Colonial Village, that's 911. It is a 911 situation, right? And we knew that this Colonial Village and others would be kind of like the Sawyer Towers, and I just think it's unacceptable. I'm not fussing at you per se, I'm just venting my frustration that our agencies aren't as prepared as they can be to respond to our community because one, a plan hasn't been put in place or provided and an assessment hasn't been done. I don't know how long it takes to bring people together to have that, to make that a reality. And so to the extent that pressure needs to be applied, I'm willing to do that so our agencies can have the resources necessary to respond to these types of critical incidents.
Right. Again, he's been pulling work groups and stuff together to try to figure out, what that whole comprehensive plan would look like. But Commissioner, I will tell you, as far as the dispatching of supportive services from this team and that's their ability, they've done a good job, and when called upon, they respond. However, us understanding where those vulnerable communities are, we don't have that information.
Are there any other questions or comments? Hearing none, then I think that will conclude today's presentation from Job and Family Services.
Thank you.
Commissioners, we will next hear from the Office of Justice Policy and Programs. However, we will need a couple of minutes to get everything set up, so we will begin here shortly. Thanks.